Hey y'all, it's Dr. Shelly. And yes, I'm wearing black because I'm in mourning. Not because I'm about to do a video on hyperthyroidism or treating it with radioactive iodine or a thyroidectomy. No, it's the day after the election and we already know that the other guy won. My girl didn't. And I'm sad about that, but I'm more devastated that more than half of our country is okay with electing a racist. They are absolutely fine with electing a fascist, I think I said that right. They are absolutely fine with electing a felon. You can't even get a project with a felony, okay? Now they finna move into the White House. So, so I'm never gonna stop fighting and hoping and believing because I'm a God's girl. But I am sad today, and it's okay if you are too. Now, if your guy won and you're excited, good for you. But I think I would address the elephant in the room before I do this video. Now, let's do our video. Our video is on hyperthyroid, and this is very near and dear to my heart because I had it. There are several reasons why your thyroid might be on some trash. It could be that it's autoimmune, like what I had. This is called Graves' disease. It could be that you have a cancer or a tumor. And that tumor could be on the pituitary or some other part of your body where it's producing too much thyroid stimulating hormone, right? Or it could be that you have a goiter or nodules just producing too much T3, T4. Whatever the reason, we're going to go through very thorough explanation about hyperthyroid and what do we do about it. And we'll also touch base a little bit on its cousin, the opposite, which is hypo. There is a separate video for hypothyroid, so I urge you to look for that. For now, let's get started. First of all, you definitely want to make sure you have your packet with you. This is endocrine. You also want to make sure that as you finger through this handout, that you visit the part of the handout that talks about hyperthyroidism. And remember that hyperthyroidism goes further and talks about the medications to treat it and the surgery that we might have to do. So that is in this packet, and the complications of the surgery is also in this packet with regards to Chavostics, tetany, and trousseaus. And so I do want you to know this thyroid, this hyperthyroid topic is heavy, right? So here we go. Yours truly. In 2016, I had Graves' disease, and every single thing in this section, for the most part, I absolutely experienced. It was odd because I have had people tell me, oh, your neck is so big. And so, I'm like, oh, really? But my thyroid labs would be normal, and the scans that I had were normal, which goes to show that the thyroid can go on fire whenever it wants to. So I was being monitored. And in fact, the October or November before my thyroid caught fire, I had normal labs. It wasn't until the March of 2016 that my labs took a turn for the worse, and I definitely took a turn for the worse. So what did I experience? What were my symptoms? Well, for example, I could feel my heart racing, but I was a bit of a workout fiend. So I attributed my fast heart rate that stayed in the 90s and 100s to working out quite a bit. I did not have AFib, but you have to remember that the patient with Graves' disease or hyperthyroid can definitely go and slip into AFib. And AFib very often goes with the tachycardic rate. I was hot. How hot were you? Well, I was so hot that my beloved students were shivering in class and they would have jackets on. The going joke was that there was icicles on their eyelashes. It was so cold in my room. I was also eating ice constantly. Big, huge cups of ice, pica, that I would get at the gas station. And I had pica because I had an additional symptom that is something we see with hyperthyroid, but not what I want you to write down. And that symptom that I had was anemia. I had a goiter. You could kind of see it. It was a big neck thing going on. I lost weight, but I thought it was because I was doing the stair steps for 20 minutes. Like I was doing big things, y'all. I was like, oh, hell yeah, get it, girl. And no, it was my thyroid. I had a very fast metabolism, which just means everything is sped up. I'd be racing around and I couldn't really be still. I was hyper. I'm kind of hyper now. I always have been, but I was really, really hyper. I did not have diarrhea, but I did have frequent loose stools, which I blamed on Activia yogurt. Shame. I mean, I had a reason for all of this stuff. And in particular, I love Activia yogurt vanilla because it has the probiotics. It's extremely healthy for kids and you. And so I was like, I'm gonna have to chill on this Activia yogurt because it's got me going to the bathroom. Here we go, 8 to 10 times a day. Pooping that much, like who does that? I could eat, are you ready? I had such a hunger. I could eat an entire big Papa John's pizza and 20 wings with that and be hungry a few hours later. I was like, oh, the way I be working out, I be working up a hunger. Honey, damn. I was so sweaty. I had perspiration, I was diaphoretic, I was clammy, so bad that my entire back, you could see my back was wet through my clothing. Yeah, it was pretty bad. My students would tell me, ooh, Miss Shelly, your back is wet. Embarrassing. My hair, it wouldn't hold a curl. It was just like straight. It was thin. Yeah, straight hair. I did not have clubbing because I believe I didn't have this disease long enough. And remember on your test that clubbing is chronic hypoxia, but I was definitely short of breath and I was exhausted. I would need help going from my classroom here down the stairs to the parking lot and to my car, which was parked very close to the door. I would ask students, could they just carry the books? How bad did it get? I had a big, huge exercise balloon, the big ones. And I got to the point where, if you know me well enough, you know I always stand up and I do my little videos. No, I always stand up and I teach. No, I had to sit on that big, huge exercise ball, and I couldn't stand up and do what I'm doing right now because I couldn't speak a whole lot of words without breathing really hard, and I was humiliated. I was embarrassed. I would turn around and say, I'd literally say, oh dear God, please, can you please give me more air? Like, I need my breath. Like, come on now, help me breathe. Like, please. Yeah, praying. Then I was, like I said, exhausted. But you know what I didn't get? And I was kind of glad I didn't get it because it is a permanent side effect. It's called exophthalmia. It's swelling and edema behind the eyeball, so much so that it pushes it out and makes it bulging. And I know when my dad got this, which is another tip, he did have the exophthalmia. And for a lot of people, this is a permanent body image change, and they're very self-conscious about it. I didn't get it. I was so happy, okay? That's called exophthalmia. Bulging eyeballs. It looks horrible. Like you can tell something's wrong because you can see the white above the eyes, the white below the eyes, the white on the side of the eyes. Really big eyes. Y'all with your girl? Y'all got me? Y'all know how vain I am. I would have cried. Amenorrhea. Now, remember, I'm a healthcare provider. I mean, I'm like delivering babies. I'm the OBGYN nurse midwife. I'm the midwife that's taking care of a huge practice. I deal with menstrual complaints all the time. One of the first things I do when you come in here telling me about your little funky period is I check your thyroid. But your girl did not clue in that this was not perimenopause. I said, oh, look at here. My eggs are all scrambled and rotten. I must be going through menopause. I don't have any more periods. That's interesting. Now, here's our issue. The definition of menopause is going a whole year without a period. Perimenopause means the 10-year time frame around the point when that diagnosis hits. So it's before, it's after, it's around. And so I just wrote it off as perimenopause. Irritability. Oh, now your girl has issues anyway, but I was screaming, like ticked off, like going the fuck off, like, and I am crazy anyway, but no, this is way, way worse. In fact, I knew that I was so bad that I went to my psychologist, who actually is somebody whose babies I delivered, like I delivered 5 of her children. And I'm like, girlfriend, I need you to check me out. Something's fucking wrong with me. Something is really bad happening to me. Yeah. Let me tell you. I went to my psychologist. She gave me an anxiety test. I scored off the charts. She goes, been knowing you a long time. Yeah, you might have a little bit of hyper kind of personality, but this whole anxiety thing, something else might be wrong. Now, at the same time, I was short of breath, like I couldn't breathe. And my boyfriend at the time he was a man, okay? A man in my life at the time. He's an ex-husband now. But anyway, he told me, you work out all the time. Why are you so short of breath walking up the stairs to my apartment? And I'm like, he's right. And I didn't have, and this is thank you, Obamacare, but I was like somebody who was like, shoot, getting a high quote for owning my own business for healthcare. So I was like, just kind of play a little bit with some cheapo insurance. So when I ended up getting married, I had great insurance, and I went to go see a doctor about this, and they flirted with the idea of perhaps I have pulmonary hypertension, and if that's what's going on, I may have anywhere between 3 to 10 years to live. Yeah, don't get me started. So, I mean, I went on a roller coaster ride for these symptoms that I was having, not knowing what was wrong, but that's how significant all of this is. The anxiety, the irritability, and oh, by the way, I had the tremors. It was really obvious that I had tremors when, I'm all about the money. So when I would put my ATM card in that slot, I could feel my hand like shaking as I did that. I'm like, what the fuck is wrong with you? You acting like an alcoholic. So that. Now, insomnia, I don't really remember insomnia, but I can tell you honestly, most of these patients have insomnia because they're hot, they are miserable, they are sweating, they're uncomfortable, their heart is racing, there may even be palpitations. Yeah. And for this patient, sometimes they can even have a high systolic blood pressure. Now, I want you to see how different this disease is from hypothyroid. And I want to remind you of what I've always taught you. Endocrine is a system of opposites. Hyperthyroid, hypothyroid. Addison's disease, Cushing's disease, opposites. Diabetes insipidus, SIADH, opposites. Hyperparathyroid, hypoparathyroid, opposites, okay? So if we look up here, I want to show you how dramatically and drastically these are exact opposites. So watch this. I want to share with you something you've got to be careful about on this test. You may get it wrong if you don't stop and think before you write or act or whatever. You would think, oh, it's hyperthyroid. Then that means that the thyroid lab TSH must be high. Stop. One of the things I tell you is when you see abbreviated letters, when you see abbreviations, say the actual word out loud. Okay, so watch this. Thyroid stimulating hormone. If I'm hyper, do I need to be stimulated? No. So the TSH is always opposite the disease. I'll say it again. The thyroid stimulating hormone is opposite the disease because the actual hormones made by the thyroid is not TSH. TSH is made by the pituitary. The actual thyroid stimulating hormone, the actual thyroid hormones that are produced by the thyroid is the T3 and the T4. Now, I have a nice little trick for you. When trying to remember TSH, although you know with this NG and NCLEX, they're going to give you your normal labs, but just because I like you educated and intelligent, and I stole it from Dr. Oz, when thinking about TSH, thyroid stimulating hormone, I want you to remember to do what we do with potassium. You know how potassium is 3.5, 5.3, how you flipped the number? For TSH, it's 0.4 to 4.0. Just flip the number, okay? So that's a nice trick. So this is hyperthyroid, could be caused by autoimmune disease called Graves, could just be thyroiditis. It is exact opposites, and let's do it together. You with me? Y'all come on now. Hurry up. Shit, I ain't got no time to wait on your ass. Here we go. Decrease TSH, increase TSH. High T3 and T4, low T3 and T4. Tachycardia, bradycardia, AFib, heart block. Heat intolerance, cold intolerance. Now, I do want you to know that both of them could have a goiter. Highly likely that the hyperthyroid patient has the goiter. Weight loss, weight gain. High metabolism, low metabolism. Diarrhea or frequent stools, constipation. High calorie diet, low calorie diet, and high fiber because of the constipation. Clammy skin, dry skin. Straight hair, even oily. Brittle nails. These are not opposites, they're just important to know. The clubbing, which is the curvature of the nail bed due to chronic hypoxia, shortness of breath, fatigue. This patient over here has slow speech. Exophthalmos does not have an opposite effect, so I just put slow thinking. A before a word means without. Amenorrhea, without periods, me thinking I'm in menopause, is the opposite of menorrhagia, which is many periods. Irritability and anxiety, depression, yeah. Insomnia, the inability to sleep, inability to sleep, insomnia, somnolence, sleepiness, right? So somnolence means you can't hardly get your ass out of bed. Somnolence is the opposite. Insomnia, inability to sleep, okay? All right, now, this other business up under these columns, when it comes to the, oh, by the way, this could be a case study. I hope your little ass paid attention. One of the things I want to make sure you remember, because I already did a video on this, but one of the things I want you to remember is for hypothyroid, you got to remember the long O sound. So Hashimoto's, everything is slow, low, and cold. Woo! All right, you got it? I'm doing pretty good today because I'm in grief recovery over this election. Now, here's our deal. Of course, we treat the hypo with levothyroxine, which is Synthroid. The complication of hypothyroid that can kill you, which is why it's in red, myxedema coma. The complication of a patient that has a hyperthyroid, I never had this complication, don't ever want it, but the complication of patients who have a hyperthyroid is going to be thyroid storm or crisis. All of this is on crack. Like it's just, you know, accentuate what they already got and put it on 10, okay? So it is deadly, thyroid storm or crisis, complications, crisis or storm, thyroid toxicosis, thyroid storm or crisis. And I do want to tell you, see all crisis people first, whether it's sickle cell crisis, thyroid crisis, hypertensive crisis, myasthenia gravis crisis, cholinergic crisis. All crises are seen first. But in this crisis, it is deadly, like all the other crises. How does it kill you? Well, your heart is doing so much craziness. It stresses your body and your heart. So you can have an MI, you can go into heart failure, congestive heart failure. Your blood pressure, all vital signs are super high, so you can have a seizure. It's a complication of that, you know that. All vital signs high, especially a high-grade fever. And remember that a high-grade fever is a fever of 102 and above. The risk factors for who gets into a thyroid storm or crisis, I did have my patient go into this. Remember OBGYN? She was pregnant. I'll never forget it. Anybody with DKA, patients who have had radioactive iodine like I have, patients who are having surgery and they haven't been diagnosed with hyperthyroid yet, like nobody knew, the surgery can trigger it. ASA, acetylsalicylic acid, aspirin therapy. Okay, so I hope you're hearing me. It is very deadly, can kill most, so you got to act fast, nurses. This patient's going to be on telemetry, probably a ventilator, definitely have an EKG. They may be very confused with altered mental status, so you're checking their LOC. You're keeping them in a very low stimulated, decreased stimulation, a cool environment because they're hot. This patient will be treated with the all famous beta blockers to calm down that heart rate. You know that already. The beta blocker of choice is propranolol. They will have PTU, which we're going to talk about down here. You will need antipyretics because they're on fire. Sometimes we use steroids. Very much we need IV fluids, and they may also need oxygen or just a ventilator. The medications that we use for this thyroid storm, thyroid crisis, or here you go, hyperthyroid patient are anti-thyroid medications. The first one is abbreviated as PTU, but it's propylthiouracil, propylthiouracil. Okay, so propylthiouracil or PTU can be toxic to the liver, hepatotoxic. So we would check our liver function test. But one reason we like PTU, P for PTU, P for pregnancy. One reason we like this is because it's okay in pregnancy, and pregnancy is a common time for crisis storm or hyperthyroid. The medication that I was given initially was called methimazole. It is a very good medication to prevent a storm or crisis right before surgery or radioactive iodine. It is a teratogen, so this patient has to have their pregnancy test checked and absolutely will need to be on very good birth control. Both of these medications we have to monitor for something called agranulocytosis. You know that A before a word means without. So we're talking about this patient being at very high risk for infection. So we're monitoring their white blood count, and you know that's a CBC, complete blood count, to check the WBCs. And so this is a very serious condition. Now we know that the medication therapy that we might choose to give this patient may not be enough, and it may not be what the endocrinologist thinks is best for the patient. So remember it like this: for patients with hyperthyroid, we can treat them with either radioactive iodine, which I had, or thyroidectomy, where we take the thyroid out, or PTU, propylthiouracil, or methimazole, okay? Now, I just gave you everything on hyperthyroid. When we come back, I will talk to you about thyroidectomy and radioactive iodine, okay? All right, deuces.